Hello, everyone. Sorry, there was a little technical difficulty. So I was trying to, let me just bring this thing a little closer. So I was trying, I was trying to get the audio going, and it was pointing at a different device. Anyways, my name is Alex Krichuan. I am a high-end, top award-winning pulmonary care practitioner in the United States, and we're going to talk a little bit about pulmonary rehabilitation, of course, COPD exacerbations. Okay, so I know there's a lot of talk with the coronavirus and people talking about their lungs are going to die and all that stuff. Understand that, even as a pulmonary care practitioner, or even any kind of therapist or doctor or anything, just understand that with any type of sickness, you're going to have a decrease in lung function just a little bit. This one with the coronavirus or COVID-19, you're going to have a significant decrease in your lung function. So knowing what to do with that type of situation is extremely important, but also understanding signs of an exacerbation. So COPD exacerbation is a flare-up of a current symptom, of your current COPD symptoms. So COPD exacerbations are common things like, let me grab a better pen than this. There we go. I'll use that. I just dropped one, of course. Anyways, so when we have a COPD exacerbation, we're having an acute flare-up. It's not chronic. We just have chronic issues, because that's what COPD stands for, chronic obstructive pulmonary disease. So anyways, when I show people an exacerbation or, things like that, I kind of want them to understand the dynamics of how it first starts, So let me just make sure that this is not, looks like it's being written in backwards. 911 looks like something else on there. I wonder if I did it this way. 119 will be, nope. There we go, 911. I have to write it backwards. I'm not sure why it does that, but anyways. All right. So on the very first, so it looks like I have to write everything in backwards for some reason. We just started doing this, the live streaming, to kind of help people out. But anyways, if anybody want to write in the comment section of any types of questions about COPD or rehabilitation in itself. So what I do is I'm a pulmonary care practitioner by heart, of course. Of course, I won a lot of awards in pulmonary rehab. My techniques are based off of freestyle diving, Olympic training, Navy SEAL training, freestyle diving. I think I mentioned that. And of course, our regular pulmonary rehab stuff. So my techniques are a little different, but we have an extremely high outcomes, especially with pulmonary rehab done virtually. So HRN, or the Home Rehabilitation Network, where I work, and about a lot of therapists work, we're a telemedicine company that provides rehabilitation, specifically pulmonary rehabilitation. So pulmonary rehab is the rehabilitation of lungs, okay? And of course, its components. The lungs are very, very huge, and sometimes we're breathing shallow. We're not opening up the lungs all the way. We're only breathing shallow. So the bottom lungs or the lungs itself kind of get neglected sometimes. But so rehabilitation rehabilitates that. We don't cure COPD, but we get the lungs to be very compliant. And well, of course, we get an increase in lung functions. And yes, you heard me right. I'm not falsifying anything. I am legally obligated to tell you the truth. Okay. So yes, you have an increase in lung functions. Even the American Lung Association, if you take a look at pulmonary rehab there on their website, will literally state that everybody, even the people with the most advanced stages of COPD, will benefit from pulmonary rehabilitation. You just want to go to a good one. We hold a 98th percentile success rate. So just understand that that's how that works. So with an exacerbation, and I do apologize, I'm not sure how to turn the screen, so I'm going to have to write backwards. And that's fine, I guess. So, okay. So the very first symptom we're going to have, let me make sure. So that's a fever, and that doesn't look like anything on there. So I have to write backwards. Should be right. Fever, yeah. I apologize. I have to try to write backwards. So, fever, right? So, I don't know. Anyways, I'll just say it because it'll probably take me too long to write them all out. So, pulmonary rehab, what we want to do is we want to, I'm sorry, not with pulmonary rehab. We're talking about exacerbations. The first symptom of an exacerbation is going to be either, it could be fever. It doesn't have to be in control all the way, fever would be on the top. That would start the fuse. If you wait till the last minute, it's going to be 911. It's an emergency. You don't wait till the last minute. You never procrastinate, right? So the first sign and symptom is usually a fever. So we have a fever, starts our fuse. Now it's going to start burning the fuse as we go along. So we got fever. Second one is what? What's our next? Our next one, if anybody realize, what would be the next one? What would you think? Chest tightness. It could be also wheezing. So there's a difference between wheezing and considering that to be a COPD exacerbation, or wheezing and finding it to be very uncontrollable. It's the wheezing that's very uncontrollable is the one that is a sign of an exacerbation. It's where you take a rescue inhaler or your respiratory medications and it's doing nothing. You're still wheezing after 5 minutes of the full onset of your albuterol treatment, whether it be nebulizer or meter dose inhaler. So an exacerbation in itself, of course, is nothing to play around with. So that's an uncontrollable situation. And waiting till the last minute obviously is going to not be the greatest thing for you. So rehabilitation, if anybody is interested in with pulmonary rehab in itself, I'll put let me type something up in here. I'm going to put www.homerehab. Okay, so I put a link there. It says www.homerehabnetwork.com. Just go to that website. You're going to see a lot of clinicians there, but with pulmonary rehab, not everybody has to have COPD to be in pulmonary rehab. Pulmonary rehab can be for anybody and everybody. We just usually take people that have COPD or bronchiectasis, asthma, cystic fibrosis, all the, emphysema, chronic bronchitis, all those. But usually people with cardiac complications, as well as any other types of complications, will actually benefit from pulmonary rehab, especially with your breathing, So if anybody has any questions or anything, or wants to write something up, I'm right here live right now. My name is Alexander Gerchuan. I'm the CEO of 2 major companies, but I'm also a pulmonary care practitioner by heart, and no one can take that away from me. But if anybody has any questions, please shout them out. So like I said, we usually have a fever first. Increase in wheezing, that might be uncontrollable. Sputum increase in sputum production, where you're starting to accumulate a lot of congestion, and it can come out clear, it can come out yellow, it can come out green, but you are having an exacerbation. Okay, fever, increase in congestion, wheezing, that's a little uncontrollable, not controllable, but uncontrollable. Okay, increased work of breathing will be pretty fair to be pretty much all the time, especially with an exacerbation versus, So anytime you have wheezing, you're going to have some increased work of breathing, of course. And of course, the very last one where it is pretty much it's pretty much too late in a sense. Not too late, but it's a very big cautionary, is when your oxygen levels go down and they don't come back up. Okay. Where your oxygen, your SpO2 value, where you measure with your pulse oximeter, goes down, but it takes either forever for it to come back up, or it doesn't come back up at all. All right. So those are the signs of an exacerbation. If anybody has any questions or would like to check us out, please stop by the homerehabnetwork.com and you'll see it. You'll see it lot of testimonies, a lot of, we see about a couple 100,000 patients, and we help them out virtually. Anyways, I'll see you guys later. Bye-bye. I sure do hope that was helpful. I'm going to have more interesting stuff in the future. I just wanted to try something out. And since I was live, kind of introduce myself. We have a lot of doctors here. We have a lot of therapists here and dietary, physical therapy, occupational, speech pathology, pulmonologists, cardiologists, respiratory therapists, nurses, PAs, or physician assistants, and as well as nurse practitioners. So those are all of our clinicians. We have a large group. Anyways, see you guys later.